Sure. So my name is B.T Kent. I'm orthopedic surgery chief resident at UC Davis Medical Center in California. And I'm here visiting Professor O in the Department of Orthopedic Surgery here on a AO trauma fellowship for the month. Sure. So the reason I chose to come to Guro Hospital and visit Professor O was my mentors worked with Professor O at various conferences, and they've done online webinars. So in discussing with my mentor after I received the AO Trauma Fellowship, he thought it'd be a great place to come. And the experience has been awesome. I mean, Professor O is a master surgeon, and all the guys have been great to work with. So, I mean, yeah, I definitely made the right choice in coming here to work with the guys. It's been great. I think having 3 trauma fellows, working with them closely, and with Professor O has been an awesome experience. They're busy. They do a bunch of surgeries. Technically, they're all great surgeons. I think they provide a high level of care to patients. It's been great to just kind of compare similar styles that we have in the United States and things that are a little bit different, and to see it done a little bit differently here, and getting introduced to not only the hospital system but the Korean culture in general. Okay, so I think there's a lot of similarities, definitely a lot of differences. The biggest difference is probably universal health care, or everyone has health care here, which is nice. In the United States, not everyone has insurance and is covered. I mean, irregardless, we still take care of any patient that comes into the hospital, and we provide the best care we can. But here it's nice that knowing that people are insured. And here I think patients have, from what I've seen, really good family support and support systems. In the United States it's similar, but probably not as good as it is here. As far as differences within the orthopedic surgery department and specifically the trauma guys, I mean, Professor O does cutting edge surgeries and techniques, and I mean, he's technically very good, and they're doing similar things to what we do in the United States. All the implants are fairly similar. There's a few things that we might have available in the United States that we use pretty frequently that might not be available here. Like one of the systems that we use to take bone graft from the medullary canal and the femur, we use a reamer system to harvest a bunch of bone graft in cases, and I don't think that system's available here. But other than that, as far as the imaging, the healthcare system, I mean, it's pretty comparative to the United States, and definitely the trauma team is doing a great job in providing a high level care to patients over here. Sure. So am I going to recommend other guys come out here? I think it was an awesome experience. I mean, they're academic over here, and they do a bunch of surgeries. So I think it's a great experience for anyone from around the world, but specifically the United States, to see something a little bit different, to see the way the guys think about things over here. Professor O is very academic, also involved in a bunch of research projects, which is great, and trying to publish a bunch of his studies. So to the guys that are younger than me, that are going into orthopedic trauma and applying to this AO fellowship, I'll for sure recommend that they come out here. I know there's a couple guys a few years younger than me that are interested.